Bipolar disorder is often loosely used as a term these days. People often casually, interchangeably use it with mood swings. What do you think is the impact on the stigma around the condition?
Well, it's very true, firstly, that these terms are used interchangeably. Bipolar disorder, depression, OCD, for mood swings, sadness, or just the fact that you like to keep things in order. And unfortunately, what this does is it trivializes the condition itself. So, a person who may actually be going through with it, struggling with it, possibly doesn't reach out because it stigmatizes it further, that it's being used as a term by just everybody for small things. So the biggest impact is that the person who is wanting to reach out may hesitate, may feel, I don't know if I can go forward. Should I be going forward? My friends keep talking about me having mood swings. What will that make my perception towards others be? So the impact that it has on stigma is the first problem. And secondly, because it is interrupting the process where a person can reach out to a professional, it impacts their quality of life further. Because bipolar disorder is a serious mental health condition, whereas a mood swing is just that. It's a temporary situational reaction to an event.
That gives me the idea that bipolar disorder can severely impact somebody's everyday life. So, with somebody struggling to understand the difference between, say, going through bipolar disorder versus their mood swings, how do they identify the symptoms?
That's a very common question, and I think it's important for us to look at what differentiates mood swings from bipolar disorder. Because the term itself, when you say disorder, it suggests that there is a significant change or a disruption. And when we look at bipolar disorder, we are largely talking about how there is a disruption in your daily functioning because of the duration and intensity of your symptoms. We look at bipolar as having two poles. One is mania and the other is depression. Often you may also come across a term called hypomania, which is called a milder form of mania, which is not as extreme. And when we look at the symptoms, it becomes very clear how it is different from a mood swing. Because when a person experiences a manic episode or a hypomanic episode, there is a significant change in their mood which is persistent, right? They may be experiencing elevated mood or euphoric mood where they are very cheerful. They might also become extremely irritable for at least 4 to 7 days. That's the criteria. You may also notice that there is excessive spending that may happen on trivial things. The person may feel that there is no need to sleep, or I don't need to sleep a lot. We call that as a reduced need for sleep. And at the same time, they may become very impulsive. And those are some of the symptoms that we look at for mania or hypomania. Additionally, when we look at depression, we are able to see that a person begins to lose interest in their everyday activities. They begin to lose interest in the things that they experienced pleasure in before the episode. You may also notice that they become very hopeless, or they begin experiencing hopelessness. They feel helpless at times. They may become very lonely or isolated. And we look at these signs as symptoms of depression, which then need to last for at least 2 weeks for us to say that a diagnosis of bipolar disorder is being established.
Let's say that I realize what I'm going through. I realize that what I'm going through is not just mood swings. It's more than that. It's more serious. It could be bipolar, but I fear acknowledging it. What is your advice for people who go through the same emotion, who fear acknowledging that what they're going through may not really be just a mood swing? It's more than that.
If we look at it, there's a very human basis to it. We all feel scared when something is unusual. We can see how an individual who notices that I am feeling very energetic might not actually realize it fully. People around them may notice this change, but they may not notice it entirely. And what happens is there are lots of thoughts that this individual may experience. For example, what if I actually have bipolar disorder? Do I need to then seek formal treatment for it? Oh, I will have a label of bipolar disorder. What will people around me think about me? What will my family have to go through? Because we also live in a place where we are very collectivistic. We don't just think about ourselves, we also think about the people around us. So the fear amplifies because now you're not just thinking about yourself, you're thinking about the people around you as well. And after going through these thoughts, I can't imagine that the person will not feel scared of reaching out to a professional. But we also know that professional intervention is the key here.
Is it possible that I end up self-diagnosing myself for bipolar disorder? Also because it overlaps with different conditions. This sometimes could be a very daunting feeling to have. What's your take on that?
We know that bipolar disorder can have very similar symptoms like other mental health conditions. For example, depression, ADHD, even aspects of anxiety disorders are noticed and seen in people with bipolar disorder. Now, an individual who may have been experiencing a depressive episode, going through lows, feeling sad, feeling demotivated to do anything, may begin experiencing a sudden burst in energy. They may feel very optimistic that I'm out of this state. And even people around them may see it as a significant change because their mood is actually becoming better. However, what may be happening here is they may be going through cyclical mood where you're going through a low mood and then your mood changes, it moves towards hypomania or mania and then it comes back. Because there's underlying cycling happening, it is possible that this person may be experiencing a disorder on the bipolar spectrum. And that is why self-diagnosis can be very misleading, because a professional can actually understand their clinical picture better. They will be able to make observations, use structured tools, interviews, also use interventions to understand what the person is going through.
That's very interesting to know. This gives me the idea that bipolar disorder definitely needs professional help, right? Are there any key strategies that really work? Is there any approach that an individual can take that will really help them ease into this journey?
We need to look at it from all different perspectives. Medical also becomes important, social also becomes important, psychological also becomes important. And if we break it down, we look at three major areas. First is a psychiatric intervention, and I cannot emphasize how much this is important, especially given the nature of bipolar disorder. Second is psychoeducation and understanding what bipolar disorder is. And then finally, we look at psychotherapy for bipolar disorder. When we look at psychiatric intervention, we look at medication that is needed to help a person experience stable mood for a prolonged period of time, because that allows the person to also have a daily life without the intense impact of bipolar disorder itself. When it comes to psychoeducation, this becomes extremely important so that the individual and the family can understand what the person is going through. The first important bit of psychoeducation is compliance with medication. Because of the strong neurobiological basis, it is important to stay consistent with medication and not miss the prescribed dosage. The next aspect that we look at is understanding what bipolar disorder is so that the family and the individual themselves can identify the warning signs. Over a period of time, they begin to understand what they are going through, when they are possibly going to move towards a depressive or a manic episode. And understanding that is one of the critical components to manage the condition over a long period of time. The third aspect is also about ensuring that you do not engage in substance use, which is very important as part of the psychoeducation process, because substances can lead to significant rapid mood changes which can disrupt the person's experience of management itself, because it can trigger a mood episode and thereby lead to a deterioration in the person's condition itself. So these important bits within psychoeducation coupled with psychiatric interventions become the first important aspect of the treatment plan itself. Then we move towards the different therapeutic approaches that can allow the person to have more tools to manage themselves and their condition better.
Bipolar disorder is not easy to deal with. but it can definitely be managed with the right resources, right?
Absolutely. And I think that is where we need to look back at why there is a delay in the first place in getting it diagnosed. Because earlier the identification of the disorder, better is the way in which earlier the identification of the disorder, a better treatment plan can be formulated as a result. And if we look at it, a lot of people, because of the stigma, because of the cyclical nature of bipolar disorder, where you do feel good after a sustained period of time, often because there are periods of normal mood where there is no significant elevation in their mood nor a depressive episode, people tend to think that it's just something normal, like a mood swing. And as a result, the delay happens, the diagnosis doesn't happen, and people have to go through difficult phases of the nature of the disorder itself. So the first part is that if the delay can be reduced, the prognosis or the way in which the disorder unfolds can be different. It can be better the earlier it is identified. B, when we look at the modalities that can be used as part of treatment approach, we again look at different aspects of medication, therapy, and also self-help that can be added. So it isn't just about professional support. It's also about how an individual is building a personal routine, a personal narrative that allows them to deal with it. It's an important distinction to make that it is a person with bipolar disorder. It isn't a bipolar disorder person. And that is the personal narrative that allows the person to cope with the disorder itself. Because when I put the person first, the diagnosis is a part of their life. It doesn't define them. There is more to the individual than just bipolar disorder. Whereas when I say it's a bipolar disorder person, I'm automatically implying a judgment that makes the individual consciously think that they are only their mental health condition and nothing more. And that's a personal coping strategy that any person needs to uncover themselves, which happens with time, which happens with the help of therapy. But you also look at how the personal story becomes so important as a coping strategy. At Amaha, we have a multidisciplinary team that overlooks an individual's condition from different lenses. We have psychiatry support, we have psychological support, and we also have psychometric assessments to track progress and also assess the condition better. We believe in having a comprehensive, individualized, and personal approach for that individual's unique needs here. Bipolar disorder is different for different people. Sometimes a single approach works for somebody, but sometimes a multifaceted approach is required. And at Amaha, we offer that multifaceted approach. Bipolar disorder may be complex, but it is very manageable. With continuous, consistent, and apt care, the distress a person experiences can reduce significantly, thereby allowing them to be more independent and have a better quality of life.